PARI, the worldwide specialists in effective drug inhalation.
At PARI, we apply a century of experience in the science of aerosol technology to develop innovative products to improve the lives of patients with respiratory diseases. In fact, the needs of respiratory patients are our driving force in providing highly efficient aerosol devices. PARI's new Vortex non-electrostatic valved holding chamber is a revolutionary new device developed to enhance the delivery of MDI medications without requiring the patient's coordination for proper technique and use. It's ideal for children as well as adults who will find it easy and simple to use. The primary difference between the PARI Vortex and conventional all-plastic holding chambers is its unique metal chamber, which doesn't maintain a static electrical charge, thereby increasing the amount of medication available to the patient. This illustration shows how conventional all-plastic holding chambers carry an electrostatic charge, which attracts and traps respirable aerosol particles, reducing the medication available to patients. The MDI receptacle vents at the distal end of the vortex initiate a cyclonic effect, which in turn creates a laminar flow of medication into the patient. This cyclonic or true vortex effect optimizes drug delivery from the chamber. Another differentiating feature of the PARI Vortex is the tapered clear mouthpiece, which directs medication into the patient's mouth, preventing aerosol tide pools that reduce medication delivery. This clear mouthpiece also allows the user or caregiver to visually confirm the aerosol delivery into the vortex's chamber. PARI's Vortex requires no priming before inhalation and offers the benefit of delivering a consistent dose. A patient's dose may vary widely with conventional all-plastic holding chambers, as they often require priming. Dose consistency can improve therapeutic outcomes, decreases unscheduled office visits, and reduces trips to the emergency room. In 1997, the National Institute of Health released guidelines recommending the use of a holding chamber when administering all inhaled corticosteroids. Vortex's design minimizes the amount of medicine deposited in the oropharynx, reducing the risk of oral yeast infections such as candidiasis. And using PARI Vortex can also be helpful in reducing the unpleasant taste reported with some inhaled medications. PARI's duckbill valve design utilizes durable, heat-resistant material to help patients with low tidal volume open and close the valve with little effort. This can be especially helpful in young children with minimal inspiratory flow when using Vortex with a mask. The one-way valve design also minimizes the effect of improperly timed actuation and inhalation to further increase the effectiveness of MDI treatments. All of the PARI Vortex materials were selected with the patient's safety in mind. The PARI Vortex is latex-free, has no sharp edges or user-accessible small parts, and accommodates a wide range of metered dose inhalers. The Vortex is compact, portable, and easy to clean. A trilingual instructional video is available from PARI, which provides detailed cleaning and care instructions for patients. If you'd like to optimize the therapeutic benefits of your patient's metered dose medications, then prescribe PARI's innovative Vortex non-electrostatic valved holding chamber. What follows is the Vortex patient education video. PARI recommends that healthcare professionals and asthma educators use the upcoming video to teach their respiratory patients and/or their parents how to properly use and maintain the Vortex.
PARI, the worldwide specialists in effective drug inhalation. For more information on the PARI Vortex non-electrostatic valved holding chamber or any other PARI products, please call your PARI respiratory equipment specialists at 1-800-FAST-NEB. PARI, the worldwide specialists in effective drug inhalation. Perhaps you've noticed that sometimes it's the little things that can make a big difference in your life, like making homemade waffles on a Saturday morning, or taking some extra time to read a favorite book to your grandchildren. At PARI, we strive to help make a difference in the lives of those affected by respiratory disease every day by developing products that deliver aerosol medications to the lungs in the most effective, most efficient way. Our goal is to help patients and those that care for them to control respiratory diseases by providing innovative aerosol therapy devices that meet the highest standards. One of the ways PARI can help you and your family breathe easier is the new PARI Vortex non-electrostatic valved holding chamber. The PARI Vortex valved holding chamber was specifically designed to optimize the delivery of respiratory medications into the patient's lungs. Plastic conventional holding chambers have static electricity, which causes medication particles to stick to the sides of the chamber. Medication particles that stick cannot be inhaled by the patient, reducing the amount of medication that is delivered to the patient's lungs. The Vortex has a non-electrostatic metal chamber to ensure that the patient gets the optimal required dose from each inhalation. In this video, we'll review simple step-by-step instructions. But remember, it's important that you also thoroughly read all instructions that come with your Vortex and meter dose inhaler as well. To use the Vortex, first check for foreign objects and damaged and/or missing parts. Second, shake the metered dose inhaler and then remove the cap. Third, insert the inhaler into the back of the Vortex. Next, if you're going to use a mask for a child, attach it and apply the mask to the child's face. If you're using the mouthpiece, simply put the mouthpiece into your mouth on top of your tongue. Be sure to close your lips tightly around the mouthpiece. Depress the MDI once and begin to inhale slowly and deeply. If possible, hold your breath for 5 to 10 seconds. Exhale normally. If your child is using a mask, keep the mask in place for 2 to 3 breaths after depressing the inhaler. The PARI Vortex is just as easy to clean as it is to use. Cleaning options include using a dishwasher or washing by hand. When using the convenience of a dishwasher, simply place the Vortex in the top shelf after disassembling the inhaler, receptacle, and mask. Accessory baskets for washing small items, such as baby bottle parts, etc., are useful to keep all the parts together in the dishwasher. Please note that the children's mask should only be washed by hand. After the dishwashing cycle is complete, remove the Vortex parts and shake out any excess water. Then, thoroughly air dry the Vortex in a vertical position on a clean, lint-free cloth. Finally, when the Vortex is completely dry, reassemble the parts and it's ready for use. To clean by hand, start by removing the inhaler and receptacle, and if a mask is used, remove it as well. Second, soak parts for 15 minutes in warm water with liquid detergent. Agitate gently by hand. Then, rinse it in clean water and shake it out in the sink. Air dry the Vortex in a vertical position on a clean, lint-free cloth. Finally, when the Vortex is completely dry, reassemble the parts and it's ready for use. Congratulations! You have purchased the most technologically advanced holding chamber available. As you can see, the PARI Vortex non-electrostatic valved holding chamber was designed to be user-friendly and flexible. PARI, the worldwide specialists in effective drug inhalation.